Hello, I'm Dr. Nathan Tanner with the Airway Center. We have the case of a 5-year-old child. Here's his photos. Chin up, elevated head posture. This is kind of a head tilt, chin lift posture, which is an airway compensation. And we see no space between his baby teeth. He's going to be 6, and either this year or next year, his incisors are going to come out. There's no room for his lower incisors to come out. He's going to have crowding in his upper anterior also. He has a big overbite, and it looks like he has excess vertical or downward growth. It'd be really good to get this upper jaw up and forward, help open up his lower jaw and develop it, but mostly open his airway at this age. Here's his pano. So we see the lower incisors overlapping on the x-ray. This lower lateral incisor is overlapping the canine. Sometimes I've seen these push out the canine. And on his upper, the lateral incisor is also going to be overlapping in the canine area. And here's the premolar. Here's the lateral incisor. And there's really no space for that permanent canine, which is up high. So a lot of times later down the road, this is going to come in either way outside or way inside, or be stuck under there, or sometimes it'll kind of rotate and start going the wrong direction. So the younger we help him start developing his jaws, the better. His second molars are coming up kind of at the corner of the jaw where the angle of the mandible comes up, and so getting his jaws forward will help this mandible really develop more forward, and he'll have some bone resorption here, and the mandible will develop more forward. His sleep questionnaire, he snores, he does some mouth breathing, sleeps in odd positions, grinds his teeth, sweats, drools, tosses and turns, bedwetting, difficulty staying asleep, difficulty going back to sleep after waking up, because he breathes better awake than he does asleep. So he has a lot to benefit by starting treatment. He scored as mild sleep apnea. On his sleep test was his respiratory disturbance index or respiratory distress 7 times an hour, every hour, all night long. 2 of those are lasting 13 seconds to 40 seconds every time. So this is every 10 minutes he's having a disruption in his sleeping, and his heart is elevating to 131 beats a minute. So he's doing a workout during part of the night instead of resting and recovering. And his stable sleep is good. His REM is really low. His unstable is low. So he's getting a lot of stable sleep. That's good. He's not really getting much REM. And the REM is really important aspect of sleep. So as he gets his airway improved, he'll get better sleep. We see his oxygen kind of coming down and back up, kind of coming down and back up repeatedly during the night. He has some fragmentation here. So definitely he has a lot to benefit. So mouth breathing, nummentallus drain, enlarged tonsils. Mom put he had somewhere. We could go back and look at his photos. I would say his palate is narrow. Anytime he has no space for those teeth, that he is definitely narrow. So let's relook at those numbers. And his range of motion, his max opening, we're not sure. But so he may have a tongue tie issue going on as well. We'll have to look farther into that.